Cranial nerve. 2. Optic nerve. 1. Introduction. 2. Structure of optic nerve. 3. Functions of cranial nerve. 4. Blood supply and lymphatics. 5. Clinical significance. 6. Different types of optic nerve disorders. The optic nerve is the second cranial nerve, CN2. It is the second of several pairs of cranial nerves. The optic nerve is a bundle of more than 1 million nerve fibers. It is responsible for transmitting visual information. The optic nerve contains only afferent, sensory, fibers. The optic nerve is really an extension of the central nervous system, brain. In the central nervous system, CNS, the optic nerve is the only cranial nerve to leave the cranial cavity. The optic nerve begins at the optic disc, a structure that is 1.5 mm, 0.06 inch, in diameter and is located at the back of the eye. In the adult, the axons of about 1.2 million retinal ganglion cells converge at the optic disc to form the optic nerve. The optic nerves of both eyes meet at the optic chiasm and form the optic tracts. The nasal retinal fibers relay sensory information from the temporal visual field of the corresponding eye. For example, the right optic tract relays sensory information from the left visual field. The optic nerve produces all sorts of visual information. The optic nerve is also responsible for the light reflex and the accommodation reflex. The light reflex allows both pupils to constrict when light is shown into one of the eyes. Important: the perception of brightness, color perception, and contrast are all possible because of the optic nerve. The ophthalmic artery, OA, is the major artery perfusing the optic nerve and is the first branch of the internal carotid artery, ICA. Numerous branches arise from the OA, but the two primary branches are the central retinal artery, CRA, and posterior ciliary arteries, PCAs. The CRA is the first branch of the OA, running within the dura mater of the optic nerve. The CRA then pierces the optic nerve at around 12 mm posterior to the globe and courses anteriorly to perfuse the inner layers of the retina. Several PCAs arise from the OA. Compromise of the optic nerve results in visual field defects and/or visual loss. The type of visual field defect depends on which region of the optic pathway is disrupted. Damage at the optic chiasm disrupts the nasal retinal fibers of both eyes, resulting in a loss of both temporal visual fields. Glaucoma. Glaucoma is a disease that damages your eye's optic nerve. It usually occurs due to fluid buildup in the front part of your eye. Hypertension. Accelerated, or malignant, hypertension is a severe increase in blood pressure to 180/120 mmHg or higher, and often over 220/120 mmHg, with signs of retinal hemorrhages and/or papilledema, swelling of the optic nerve. Drusen. Optic disc. Drusen is a condition that affects vision and the optic nerve, the connection between the eye and the brain.